Hi, I'm Dr. Thomas Kiska, and I develop precision health solutions to provide the proactive patient a health maintenance system to stay healthy and to accurately monitor their health. Precision Health Solutions is developed from 5 different healthcare platforms. We utilize your blood chemistry analysis and your DNA analysis to scientifically make all your dietary and nutritional recommendations. We simply analyze all your bioinformatics against multiple research platforms, and we take the guesswork out of you putting together your preventive health program. Precision Health Solutions is designed to help you attain, then maintain, and to monitor your health accurately. Now I'd like to review the 2 primary platforms that are central to Precision Health Solutions, that being science-based nutrition, the blood chemistry analysis, and genomic insight, the DNA analysis. Okay, this is my science-based nutrition blood chemistry analysis report. Keep in mind, this is formulated through a blood chemistry analysis of 62 different blood items and also through a 37-page questionnaire. This report, most importantly, identifies early stage disease processes. It reviews drug nutrient depletions for anybody taking medications, and it also finds our primary blood imbalances and specifically prescribe nutrition recommendations to normalize those blood imbalances. As we look at my report, I'm a type O blood, so therefore we provide a platform that will give you specific dietary recommendations for that. As we review down, these were my primary symptoms that I have, that I'm more worried about, that I want to improve with this report. These are my presenting symptoms from the questionnaire. My primary findings from my blood were suggestive of these conditions. Each of these conditions are broken down in the diagnostic findings. For instance, this one was about my cholesterol. It was these other things in my blood supported this finding. These are the symptoms related to it. And then here's what nutritional items from Thorne Research we would recommend to normalize this blood imbalance. And they do this for every one of those imbalances. Now I want to take you down to the blood chemistry analysis. The blood chemistry analysis has 2 different ranges, the clinical ranges and the healthy ranges. The clinical ranges are the medical ranges. Healthy ranges are tightened up ranges, which are healthier. The medical ranges will come up in red if they're out of those range, and they'll come up yellow if they're out of the healthy ranges. Things we're looking for here are, most importantly, 4 different markers that are relative to early disease processes. Creatinine kinase will go up in heart disease and a lot of other diseases. LDH will go up anytime there's cell death. We also have a C-reactive protein, which is an inflammatory marker, and SED rate will also go up in early stage disease. So if we do this yearly, we won't have any early stage disease catching up on us. Being it a late stage cancer, which I've seen over 30 years of practice pop up way too many times. Keep in mind also blood vitamin D levels. I want to see these levels high because the higher the vitamin D level, the lower our cancer incidence. The higher our vitamin D level, the lower our heart disease incidence. 7 out of 10 of us are going to die from heart disease or cancer, so I want to see these levels fairly high. So basically, this report breaks down our blood analysis, identifies any early stage disease process. If there is any stage disease, we get it to the medical professional specific for that area. It also identifies our imbalances, gives specific nutritional recommendations for those imbalances, and it gives those specific for Thorne Research. Thorne Research is a premier professional nutritional company that is endorsed by many professional athletes, many professional teams, many university medical centers, many universities, and specifically by Mayo Clinic in their research studies. So we provide you a nutrition program that's very specific to normalize your blood chemistry panels with Thorne Research products, and we provide you a 25% discount on all Thorne products. This is my DNA analysis that's done by Diagnostic Solutions Laboratory on the Opus 23 Explorer artificial intelligence platform. Here's me. If we go down to the bottom, I have 2,840 different DNA SNPs or studies that are related to specific biological activity. If we look over here, I've got 15 on each page, all related to type 2 diabetes, obesity, asthma, etc. I have 190 pages of 15 on each page. So I essentially have a catalog of my gene mutations and how my body works in the different organ systems. I can cross-reference this against all the PubMed research out there and all the genomic research for any item out there or any disease process. So this one is for pancreatic cancer. I have there's 21 SNPs for pancreatic cancer, of which the orange are definite mutations, the gray are no mutations, the half orange are half mutations, if you will. Listed in order of magnitude, I have the highest magnitude for pancreatic cancer. On page 2, on number 21, I have the lowest one for pancreatic cancer. So in this medical chapter that we're opening on type 2 diabetics, I probably don't want to take one of the type 2 diabetic medications that involve a pancreatic mechanism. Now going back, I can also cross-reference this against coronary artery disease or coronary heart disease. So coronary heart disease. Yes, there's 24 different SNPs directly related to that. I have the 2 highest ones. So I can provide then nutritional information to help fortify against the expression of these genes. And I'll show you how that's done. But just keep in mind, I have a 190-page catalog that are specific to me. And I can cross-reference any disease process, most anything that's in the medical research, I can cross-reference my genes against. I want to go to syndrome templates here. This is essentially, and again, the orange are full mutations, these are half mutations, these are no mutations in the gray. This is essentially a genetic fingerprint of my gastrointestinal system, my thyroid system, these are some of my endocrine system, my nervous system, all the way down. So every system, every organ system of my body, all the way down to my male genomics or my androgen genomics, if you will. Just to show you how deep we can go with this, this is one SNP that I have. That's a mutation in my TPH2. It has to do with my endocrine system. I can jump into that. This is has to do with my tryptophan and my melatonin, my serotonin pathways. TPH2, this will give a definition of that, and will also say it'll give nutritional recommendations specific to fortify this gene area, and what the research says that vitamin D is very helpful to this. So I should supplement that into my specific personal preventive health program. So keep in mind that we do have a genetic fingerprint from this study of all the different organ systems, and we can dive into. There's an enormous amount of information here. Getting now into another tool here. This is the prescriptive tool. This is the pharmacogenomics. We can cross-reference your genes against 67 different medication groups. For instance, this is an epilepsy drug. This would not be a good one for me because it would put me at a higher risk of Stevens-Johnson syndrome, which is a terrible skin disorder. So keep in mind we can cross-reference that or your genes against 67 different classes of medication. Another thing that I like to cross-reference my genes against are all the natural products. So with this, there's 825 natural products listed in order of importance for me. So from highest importance to lowest importance. And if we're looking, we talked about vitamin D. Vitamin D is important for me, and there's 69 published medical journal articles that say why vitamin D is important for me. If I look here, selenium is very important for me, and that's because that has to do with the glutathione pathways, of which I have a pretty high power factor of a mutation in that area. So again, your DNA is cross-referenced against all the PubMed research, and then it allows us to identify from that research what nutrition items would be most important for you. And I'm going to demonstrate that here
on an artificial intelligence platform. So this lists all my largest gene mutations that have the largest disease or condition factors to them. So with this, I want to take my highest ones and I want to cross-reference them against what nutrients I should take. So after I get somebody healthy with the science-based nutrition program and we have their blood balance, then we can further accent that and look at what nutrients are needed from their largest gene mutations so that we can really preventively and proactively kind of give them a very specific science-based preventive health program. So for instance here, the larger the circle, the more indicated the nutrient. The blues are ones that involve multiple DNA SNPs, and the greens or the yellows are just single relationships. So B12 is important to me, folate is important to me, betaine is important to me, riboflavin is very important to me. Also probiotics are my FUT2. I've got a problem there with some of my digestive issues. So probiotics are important for me, and also all these different B vitamins, and there's a couple other things that I get from this. But what I can do now is I can take a person's nutrition program and I can cross-reference it against their largest DNA mutations, and I can really very specifically highlight their nutrition program to address their largest gene mutations and possibly prevent some of their gene expression in those areas. So we really take the guesswork out of nutrition programs here, and we just have a very scientific program designed for the patient to stay healthy and to design nutrition programs.
So as you can see, Precision Health Solutions is a very science-based, research-based health maintenance program designed to attain your health. If you're someone who wants to stay healthy and want the most scientific system to maintain and monitor your health, enroll in Precision Health Solutions.